Hi, my name is Deborah Hammond. I'm a psychiatric mental health nurse practitioner student at Eastern Kentucky University, and today I will be presenting a project proposal that I created. Depression is extremely common, affecting more than 7% of the U.S. adult population, and it is highly likely that depressive disorders will become more and more ubiquitous. 2 depression objectives can be found within Healthy People 2020. These objectives reveal that interventions to fight depression are a national public health priority. Healthy People 2020 seeks to decrease major depressive disorders and increase screening for depression by primary care providers for patients of all ages. Psychiatric mental health nurse practitioners must be prepared to identify and treat patients suffering from depression. Symptoms of depression have severe consequences, which increase mortality and health risks. The purpose of this proposal is to provide evidence which supports the effectiveness of cognitive behavioral therapy, or let's call it CBT for wordiness, for depressive symptoms in adults, and to propose a project that would make weekly CBT the standard outpatient treatment for adults suffering from depression within our organization. To find relative articles for this proposal, CINAHL, PubMed, Cochrane, and PsycInfo library databases were carefully searched for studies which were less than 10 years old. 8 studies which supported the efficacy of CBT were identified and 4 were chosen. There is strong, consistent, and compelling evidence within the chosen studies which suggest CBT is an effective intervention for depression in the adult populations. The studies by Lee and others and Kiriotaki and others are meta-analyses. Meta-analyses are considered the highest level of evidence according to Melnick and Feinout-Overholt's hierarchy of evidence. All studies used by Lee and others were random controlled trials, and the results were consistent between the studies. Random controlled trials like the one by Wiles and others is considered the second highest level of evidence. The intention to treat analysis of this study showed no risk of bias, which indicates reliable results. The qualitative study by Lilival and others was lower on the hierarchy of evidence, a level 6, but was useful with regard to analyzing applicability and adherence to interventions using the patient's own words. Each study showed results consistent with other similar studies. However, the studies in this project proposal suffer from a relatively small sample size. The random controlled trial was one of the largest to date at a mere 469 participants. There is a gap within the literature when searching for studies which specifically investigate the positive effects of CBT on depression in the adult population. Lee and others were only able to find 6 suitable studies to support CBT as an intervention for their meta-analysis, even though the researchers searched with no limits on the age of studies. Regardless of sample size, the information within each of these studies is very valuable to advanced nursing practice and for clinics considering implementation of CBT. Larger studies and the project which I am currently proposing will help to disseminate CBT as an intervention for adult depression. Psychiatric mental health nurse practitioners versed in CBT can offer it as an effective alternative to antidepressant medication or as an adjunct to medication treatment. The following implications found within the literature, I propose that our organization integrate CBT into the weekly treatment plan for adults suffering from depression for 6 months on a trial basis. I will be responsible for project leadership, and I will oversee implementation, recruitment of the interprofessional team, and recruitment of participants. The interprofessional team will consist of care providers within the outpatient facility, such as managers, supervisors, therapists, psychiatrists, psychiatric nurse practitioners, and all nursing staff. The participant identification will take place over the course of a month. Patients will be screened using the Beck's Depression Inventory. Patients with positive screenings will be approached, and those interested will give consent and take part in the project and will receive weekly CBT sessions. CBT sessions will take place for 6 months. Therapists and psychiatric mental health nurse practitioners who already work within the organization will conduct the CBT. If additional staff is needed to provide weekly CBT, more will be hired on a temporary basis. Hiring a temporary employee to conduct CBT would cost approximately $25,000 to $100,000 for 7 months. However, the cost of the new employee would not exceed revenue created from insurance payments for CBT. CBT activities and homework worksheets can be accessed for free on therapistaid.com. Outcomes will be measured using the Outcomes will be measured using the Beck's Depression Inventory after 3 months of therapy, which would be the halfway point, and after completing the full 6 months of therapy. Upon completion of the project, patients' outcomes will be analyzed and project results will be discussed with stakeholders. Findings will be disseminated to the community through publications and podium presentations. There is little to no risk of an ethical violation when conducting CBT. As with any talk therapy, patients can be at risk for feelings of distress when discussing emotional trauma. However, considering its efficacy, it might be more of a risk not to attempt CBT as a treatment for depression. Depression decreases quality of life and increases the risk for mortality. CBT is an effective intervention where the patient's level of involvement is directly related to successful treatment. CBT can reduce suffering and enable patients to change their way of thinking. CBT is a feasible intervention in which the benefits outweigh the risk. Considering the efficacy illustrated by these studies, it is imperative that members of our organization go forth with this project. That completes my proposal. Thank you for your time. Please contact me with any further questions. Thank you.